Welcome, welcome. Happy Friday, everyone. We're so glad you join us each week. We're so grateful for our community. We welcome you to just settle in and get ready. We've got a great webinar today planned. We'd love to hear where you're coming from. If you want to write into the chat, let us know where you're joining us from. And we'll be beginning here in a few moments. We're streaming live on Facebook. Alicia, hello, coming in from Hartford, Connecticut, one of our fellows. Alexandra, coming in from Austin, Texas. Welcome. We're so happy to have you here. We hope everyone is safe and healthy. We know there's a lot going on. And we hope you have an opportunity for a little stretch before we get started. Maybe a sip of water, very important.
Okay, welcome everyone. Again, thank you for joining us for our Friday Wellness webinar. We do this every week. At the beginning of the week, we gather our community for Meditation Monday, and at the end of the week, we end our work week with a wellness webinar. And today we are just really thrilled to have Dr. Lorenzo Cohen with us. He is the Director of Integrative Medicine from the University of Texas MD Anderson Cancer Center. And he's going to be talking on a topic called On the Road Less Traveled, Exploring the Effects of Biofield Therapies in Oncology. So as people are coming in, just let us know where you're from. And in the meantime, if this is your first time with us, we are the Academy of Integrative Health and Medicine. We're a global interprofessional integrative health association working to transform healthcare, body, mind, spirit, community, and planet. And so all sorts of practitioners from MDs, nurses, naturopathic doctors, chiropractors, acupuncturists, and all of the allied health professionals who are interested in integrative health and transforming our systems to be more people-centered and holistic, we invite you to join us. So today, we really just have the pleasure of welcoming our special guest, Lorenzo Cohen. He is a Richard E. Haynes Distinguished Professor in Clinical Cancer Prevention. He's the Director of the Integrative Medicine Program at the University of Texas MD Anderson Cancer Center in Houston. He is a Distinguished Clinical Professor from Fudan University Cancer Hospital in Shanghai, China. He's the founding member and past president of the International Society for Integrative Oncology and the past vice chair of the Academic Consortium for Integrative Medicine and Health, both organizations that AIHM just really supports and loves the work that both of those groups have been doing for decades. He leads NIH-funded research delivering clinical cancer treatment with integrative medicine practitioners such as meditation, yoga, Tai Chi, massage, diet, exercise, acupuncture, and more. So Dr. Cohen, it is just such a pleasure to have you here, and we welcome you.
Thank you. Great to have been invited to join, and I'm pleased to see that you, like other organizations, have been able to take advantage, let's say, of this unique situation we find ourselves in. I'm giving, I think, more talks on average in the past 6 months per month than I have in other points in my career, because it's so easy to be invited, and most people are more open to saying yes when we don't have to get on a plane and all the rest of it. So there's, of course, a lot of negatives that we're all struggling with in these past 6 months, and I assume, another 12 months going forward. But there's also the positives that we need to cherish and celebrate. And thank you all for joining today. So before sharing my slides, I thought I'd tell you a little bit about what we do in general, and why it is that I've chosen this topic of biofield. So like many of you, and you heard, I'm not a part of AIHM, personally not being a practitioner, but more of the researcher helping to guide this whole area of integrative medicine forward. But I've been now at MD Anderson for over 20 years, and really focused in trying to foster health and wellness through more of this integrative approach. And we've been, I feel comfortable saying, very successful at changing the culture and changing the landscape of cancer care at MD Anderson. And although insurance companies may not necessarily be stepping up to the same degree as we want them to, as far as the healthcare professionals are concerned, in particular the oncologists and the nurses and the PAs, we are in their tent, and they refer, and we are always overwhelmed with the referrals that we get for acupuncture, for massage, music therapy. Now, as you probably all know, the ASCO and the National Comprehensive Cancer Network, which is made up of the 50+ comprehensive cancer centers, have clinical practice guidelines that include acupuncture, yoga, and then, of course, if we fold in the whole area of lifestyle, this clear acceptance that patients who remain healthy through diet, exercise, stress management, they live longer, they do better, they have a higher probability of response to treatment. So I'm not going to talk to you today about all of those areas, and I took the time with my wife to write a book called Anti-Cancer Living, Transform Your Life and Health with the Mix of Six, as a way to communicate all of that information, primarily to the lay public, to cancer patients, people looking to prevent that diagnosis in the first place, but also was lucky enough to have the publisher agree to allow us to put in over 1,000 references, which really support the critical role of lifestyle. And of course, it's not just for preventing cancer and improving outcomes for somebody with cancer. The same prescription, of course, is to prevent and help treat heart disease, stroke, diabetes, Alzheimer's, all the non-communicable diseases that I know you all struggle with clinically with your clients, trying to get them to take part responsibility in their health and wellness. So instead of the overused phrase, coals to Newcastle, I thought I'd take us on a slightly different journey. And let me just bring up my slides here. Why isn't it sharing? I guess I can do it through my desktop. And then just, you guys are just seeing the slides, right? Okay, perfect. So biofield therapies, in fact, before getting into the details, this is actually an area that certainly at MD Anderson, we don't talk about publicly. We do research in this area, but we don't offer treatments like Reiki or healing touch. This is, as many of you know, the kind of lightning rod of integrative medicine. And when you talk about these therapies that are using biofields, whether that's homeopathy or the energy medicine, often another term that's used for this, it kind of freaks out the conventional world. So much so, of course, as many of you know, that the NCCIH used to fund this area, and now, of course, will not fund this area, even for exploratory research purposes, which, you know, is a totally inappropriate, unscientific way to run science and exploration, but they didn't want to take the political heat. We have been very interested in this area at MD Anderson, as have many other people in the world. And what's quite interesting is that when you get into the details and you talk to people about this concept of biofield, and when we talk about it in terms of information and energy that is used within our body as a way to essentially transmit information through the different systems in our body, nobody has a problem with this, right? This concept of energy medicine, as we see pictured here in terms of a EEG or an ECG, EKG. I mean, this is accepted, right? That there's a bioelectrical activity that is going on in our body, and we can actually measure that. And wherever you have electrical activity and impulses, you're also going to have magnetic. So it's this electromagnetic activity that is part of the body. Where things are a little bit different is when we start talking about these more putative, subtle forms of energy. And if we look at our colleagues to the West and you know, the history of medicine, they talk of these things as a vital force within the body, from China known as qi, or India known as prana, and Japan known as ki, this bioelectrical impulses that are flowing throughout the body. And a lot of the premise of some of these Eastern-based traditions is based on that model. In terms of biophoton detection, all organisms emit biophotons, so, you know, electrical activity coming off the surface of the body. It happens in particular during excitation states and involves oxidation and ROS, and you can measure this even just, you know, from doing strenuous exercise. We also see emissions when tumors are transplanted, like in animal models. The biofield actually has a diurnal rhythm, and there's evolving area of diagnostics as a potential research tool. And one example of that is the squid, which is detecting extremely low biomagnetic frequencies, and they're exploring this as a way to detect cancer earlier than all the other devices that are currently available. Now, when we start talking about ultra weak photon emissions, we can actually detect this from cell cultures, and you can detect this on the surface of the body. We even see this when cells are separated chemically, but they're connected through a thin glass film. So there is this communication that's going on. And of course, you know, we can pick this up with EEG. Now, again, if we talk about devices, and we use this term energy medicine, well, you know, cancer's been using energy medicine for centuries. And in fact, radiotherapy is a form of energy medicine. It is the delivery of high frequency photons through radiotherapy as a treatment for cancer. We're also, of course, now evolving and using different technologies such as photon therapy. But again, it's putting a source of energy into the body for healing purposes. This is an area that is expanding dramatically, in particular as we learn more about the brain and the brain's control of the body. And there's, of course, FDA-approved devices you're all familiar with, for example, pulsed electromagnetic therapy, TMS as a treatment for recurrent unremitting depression, low laser therapy, and most recently in the area of cancer, the use of electromagnetic fields, as you see pictured there on the bottom right, from a company called NovoCure for the treatment of recurrent GBM, a very difficult to treat brain cancer. So this is, nothing new in the world of let's call it bioelectronics, and something that is continuing to be investigated. But when we start to think about interventions from this area of biofield, that's where things get a little bit different, in particular when it's coming from a human. So when we look at practices like yoga, tai chi, qigong, some could view these as biofield practices. However, in our research at MD Anderson, and in order to get funding from the NIH, and a lot of you would prescribe these practices to your patients more from a biobehavioral perspective, that yoga helps to decrease sympathetic nervous system activation, clearly changing bioelectrical activity of the brain, leading to a decrease in sympathetic tone, increase in parasympathetic tone, cortisol and norepinephrine go down, there's a calming of the system, patients are more relaxed, blood pressure goes down, et cetera, et cetera. We could give a whole talk, of course, just on these types of treatments. And I've seen that, in some of your past series, there's been, importantly, a good focus on the mind-body practices that, again, are primarily being approached from this biobehavioral perspective. However, if we look at the origins of these practices from India, Tai Chi, from China, yoga, from India, qigong, some of the other practices coming out of Japan and Tibet, that their purpose isn't to decrease sympathetic nervous system arousal and increase parasympathetic tone. That isn't what their origins were, and it in some aspects has to do with being able to balance the body, balance the flow, I guess you could say, of energy in the body. But again, something that we tend to not focus on, and we'll get into some of those issues, but part of it is a measurement issue. Now, those aside, and not even thinking of them as biofield therapies, there are clear treatments that are have their origins in and therapeutic benefit from harnessing the energy of one's own body and transmitting it to another person, or in some cases, just allowing the other person, the client, the receiver, to open up their own healing through their own energetic processes. And these are these external treatments such as Reiki, therapeutic touch, healing touch, qigong. There are others, but those four are probably the most researched. And again, it's a practitioner that is separate from the client, from the receiver, who has been trained in a particular manner to be able to work with the client, typically not having any touch. And often there's claims, of course, that this can be done at a distance. And that's where things get really weird for a lot of conventional scientists, because they don't quite understand how there could be this cause and effect. And in the Q&A, we can get into some of the details behind that. But one of the challenges, I think, is in measurement. And this is nothing new in the history of science. And I think where we have often gone off track in science and not been open to what we are actually seeing with our own eyes is this lack of understanding of the mechanism. And of course, Galileo, there's many reasons why, Galileo was dismissed and sent into exile from the scientific world for political reasons and, the church and that aspect, but also an issue around measurement. Darwin, similarly, it's a theory, right? Even though there is just overwhelming evidence, and shockingly, there's probably only one country in the world that has such an issue with evolutionary theory, and it's probably the United States, which is, most disturbing in a whole other conversation. But Darwin, of course, struggled to get his ideas believed. Pasteur, more recently, Judah Folkman. We had the honor of having Dr. Folkman as a speaker at the SIO early on in our society's history. And he, for those who don't know, Judah's the person who essentially discovered angiogenesis, right? The ability of, in particular, cancer cells to, and cancer microenvironment to form its own vascular system. And he showed us at that point what were called the pink sheets, because the NIH grant review system literally sent the reviews out on pink pieces of paper. And he highlighted one of the primary reviewer for what was back then, I think, an R01, trying to get funding for angiogenesis research. And the reviewer said there's only one person in the world who believes such a ridiculous concept of angiogenesis, and that's the principal investigator of this application. Now, of course, angiogenesis has proven to not only be true and very active, but has led to the development of multiple drugs for multiple conditions, not the least is, of course, cancer. And then, of course, many of you are familiar with Bob Ader and the wonderful work he did with Nick Cohen, really the fathers of the field of psychoneuroimmunology, breaking down the Cartesian dualism, that there was a separation between mind and body, and this clear link that the brain influences the body, and now we know the body influencing the brain, etc. And you're probably all familiar with Dr. Semmelweis, and I won't go into all the details here, but he, had first an observation that babies that were being delivered in one ward of the hospital where he was working in Hungary had much lower incidence of mortality, both for the child as well as for the mother. And he started to, observe and to try and understand what were some of the differences. Well, in one ward, in the first ward, the babies were being delivered by midwives, and they tended to wash their hands before the delivery. And in the second clinic, they were being delivered by the physicians, and they tended to not wash their hands before delivery. And then he did a whole complex series of experiments, and now we're talking about the 1800s here, so the RCT wasn't designed and all the rest of that, but to the degree that he could, and he looked at different ways of washing the hand, it could clearly demonstrate that there was a difference in mortality and experiencing fever after a chlorine wash. And this was something that was ignored. He was ridiculed, and you can go and read the history of poor Semmelweis, but it did not end well. And today, of course, he would have been awarded the Nobel Prize for such an important discovery that is helping us, as wearing a mask and washing your hands. Those are the two most important things we can do at the moment to stay healthy and not contract SARS-CoV-2 virus. And he was summarily ignored, and that was because this was pre-germ theory. So we didn't know that there was such a thing called germs and these microscopic things that were getting people sick. And so he was essentially ignored even in the face of evidence. So you're all familiar with the theories of Thomas Kuhn and the structure of scientific revolutions. And he posits that there needs to be this dramatic discovery like germs. Then there's a whole change in the paradigm. And although, you know, that is the case in many scientific leaps that happen, there's also challenges to that. And there's these small steps forward. And I would say in the area of mind-body medicine, I think we've seen these small steps forward, incremental discoveries. In the area of energy medicine, maybe it's going to need to be something a little more dramatic. So let's get into some of the research here. And I'll talk a bit about this treatment called therapeutic touch that has been researched both clinically as well as preclinically. And I'll show you some examples of this research before getting into some of the work that we're doing at MD Anderson. So I'm not going to read the slide, but you can see the basic structure of what therapeutic touch is. It is a very fixed kind of training, and it's replicable. And there's different levels that you can go through in the training. And an interesting thing to note, and you hear this in a lot of biofield therapy, this area of energy medicine, and that last bullet is the highest good for the individual. And you know, where this can become challenging and an interesting area is end-of-life care. And practitioners have shared consistently across different traditions and practices that the highest good for that individual who could be in hospice is actually a speedy and painless death. And all of you who care for patients at the end of life know that in some sense that is a gift for the patient as well as the family once you're at that point. So it's not, you know, survival above all else. It's actually whatever is at the highest good for that individual, for the receiver. So Gloria Kronowitz, as well as others, but she's done probably the most exceptional work in preclinical research of therapeutic touch. Started with osteoblasts and clearly found that there was an increase in proliferation of these osteoblast cells and no effect on the effects of proliferation from osteosarcoma cell line. There was an increase in, a decrease in mineralization and matrix protein synthesis, and this is suggestive of decreasing the proliferation of bone tumors. She found an increase in bone matrix protein synthesis and mineralization, suggesting that therapeutic touch could actually stimulate bone formation, and that there was a stimulation of normal human cells from bone, tendon, and skin. And she, you know, replicated this a number of times, published it in conventional journals as well as more CAM-related journals. More recently, she looked at a breast cancer mouse model, so moving out of the petri dish and into in vivo models. And in this study here, actually had a control group, a non-treatment control group, as well as a cancer sham group, and then the therapeutic touch group. And you can see here, you know, comparing sham, which is the middle bar, the middle representation of the animals, compared to the therapeutic touch, clearly a significantly less number of metastatic colonies. So this was a metastatic breast cancer model if the animals had been exposed to therapeutic touch. And she also looked at some of the mechanisms. So, of course, inflammation we know as a mechanism for cancer growth. And we see here in the therapeutic touch group compared to the cancer group that didn't have any therapeutic touch. They were in the sham group. There was less of an increase in IL-1 alpha, IL-1 beta, MIP2, as well as MIG. These are both chemokines that are related to these inflammatory processes. Similar immune functions, so there was a decrease in macrophage infiltration, and macrophages can actually increase the growth of tumors, in particular in metastatic sites and in the tumor microenvironment. And similarly, increases in non-Treg cells, as well as decreases in Treg, both showing that in the tumor microenvironment, we're seeing an immune profile that is prone to decrease cancer growth in the animals, again, that were exposed to therapeutic touch compared to the control animals. This is work out of Harvard, and with collaborators at the Dana-Farber Cancer Institute, where they looked at a form of what they call Yanqing qigong. And they've published a number of different studies, I think about a half a dozen or so, and this is just an example of one of them. All of them preclinical and in vitro. They never went to the in vivo model. But what's interesting and what you can do when you do cell work is actually look at the biological activity that's going on in the cells. And here in particular, looking at AKT and ERK1 and 2, phosphorylation, NF-kappa B, all systems related to proliferation and NF-kappa B in terms of inflammation, TNF that you see on the bottom right, again, related to inflammatory pathways. So we're seeing a clear impact here in a petri dish, at least, of this was prostate cancer cell line. So, again, just a few examples of some of the work that's been done in this area, but there is much more. And what's fascinating about this is that, of course, there shouldn't be an effect. And in most of these studies, they're well controlled, and there's appropriate controls, as you saw from Gronowitz's research, where there's multiple control groups being able to demonstrate that there's really something going on here and warrants further investigation. Now, when you move to human studies, and there's a number of reviews that are highlighted there for those wanting to do further reading on the topic, one of the challenges is the methodology and issues, of course, around control groups and being able to have, and that's a whole other discussion, what is the best control group, and is it critical to have placebo? Obviously, when we're doing animal work, we don't tend to worry as much about placebo, and certainly when we're doing cell work, we think, of course, that's not relevant. But in human models, of course, the randomized, double-blind, placebo-controlled trial is, of course, the gold standard. And we tend to not see a lot of that in biofield research. The studies have been done, and some have been very well controlled in terms of having placebo, in terms of having, in particular, the patients blinded, so they're behind a sheet, for example, in some very good pain studies. And there is evidence in particular to show the benefits of something like therapeutic touch and healing touch for reducing pain. And then in some of the other areas that I won't read because you can see them pictured here, it's either moderate evidence or mixed evidence. Now, you know, when you look at the risk profile of some of these treatments and the evidence, you know, be it mixed or moderate, it suggests that further research is warranted because it is helping people and we need to get a better understanding of this. An interesting example of an institution that felt they didn't need to have the randomized placebo-controlled trial to implement something like healing touch is the University of Maryland, and where Brian Berman is, and has successfully was able to integrate healing touch into their trauma unit. And it's not because there was overwhelming evidence from a randomized placebo-controlled trial published in the New England Journal of Medicine. It's because they started doing it, and the practitioners on the board saw and were able to clearly understand and see with their own eyes the benefit. And in some sense, that's all that mattered to them. We had a similar experience with acupuncture in our pain center, a single arm pragmatic trial showing benefit. And more important than the data, and in fact, halfway through the study, the head of the pain center, you know, essentially acknowledged that, you know, he was skeptical that acupuncture would do any benefit for the patients they sent us. But in seeing the benefit, he knew that from his perspective, acupuncture was real and not just placebo, because everything that they were trying wasn't working for the patients they sent to us. So, you know, that's kind of an aside, but, you know, to what degree do you need evidence, and what does evidence mean before you're able to implement something? Well, you know, again, something like therapeutic touch, healing touch, side effects are low, and for some people, the benefit is high. This is just, you know, I'll give you a couple of examples of some of the better clinical trials. Susan Lunkendorf out of the University of Iowa did a great study of therapeutic touch. You wouldn't know that from the title, right? And I think that you know, this is a challenge that we face in the field of biofield and energy medicine. She didn't put that word in the title. She called it a novel integrative approach. And of course, when you get into the details of, you know, what is this novel integrative approach, it was healing touch that you see pictured there. So 60 cervical cancer patients who were undergoing radiotherapy, and a common side effect, of course, is fatigue, among other symptoms. And importantly, they had a relaxation group. So if this had something to do with the relaxation response, there would be some benefit from that, I guess you could call a kind of attention control group, but really an active control group. And then of course she had usual care. So she also looked at immune function, and importantly, that is less subject to biases associated with blinding, of course. And we see a preservation, a decrease, modestly so in all the groups, but less so if they were in the healing touch group by the end of radiotherapy. And for a measure of depressive symptoms, we see it favoring really the healing touch group, and the relaxation group falling in the moderate zone. And we see the same kind of thing with yoga compared to other forms of movement and exercise. So here, both a subjective symptom report as well as an immune function outcome. Shamini Jain did this work with others, including Paul Mills at UCSD. And this was similarly, I think it was a study of therapeutic touch. And as you can see here, they also don't have that term in the title of the article. It's a complementary medicine. But of course, you can see that it's what they called a healing group, but it was a form of therapeutic touch. And she had a mock healing group, which was very important, and then the weightless control group. So here we see the measure of fatigue, really favoring the healing touch group, but a modest and moderate effect for the placebo group. And of course, that's something that you would expect. And if you didn't have a placebo effect, you would wonder, how good is your placebo? Importantly, an effect on cortisol slope. So we see similar outcomes in our yoga research, where we know that a steeper slope is predictive of actually better mortality outcomes for breast cancer patients, lung cancer patients. We've published on kidney cancer patients. And here we see a maintaining of a steeper slope in the healing group compared to the other two groups at the post-intervention time point. So again, both a subjective measure as well as a biological measure. And very importantly, in both these studies, there was that extra attention or sham control group. So early in my time at MD Anderson, was actually approached by Kevin Chen, who at the time was in New Jersey at, I can't remember, at Rutgers, an institution in New Jersey. And he was doing external qigong research funded by NCAM for osteoarthritis of the knee. And the qigong master that he was working with, Master He, was had experience in working with cancer patients and had documented anecdotally within his own practice that he can actually make tumors get smaller and in some cases disappear. Now, there wasn't a lot of evidence, and I was actually around that same time received an email from somebody I didn't know out of the Bay Area who said, is there any evidence to say that external qigong doesn't work? Because my wife, who has stage 1 curable breast cancer, is going to see a qigong master instead of having surgery. And he was understandably very upset that his wife wasn't getting conventional treatment. And, my response was, that there isn't evidence that it will work, but equally there isn't evidence to say that it wouldn't work in terms of clinical trials. And if you go on the internet and actually look at what's out there, there's more anecdotal evidence to suggest that it actually would work. And so, we embarked on this study because, we could do good science. We could look at the tumors before surgery and the tumors after surgery. Importantly, I approached the head of clinical research at MD Anderson, Maury Markman, who is very open to this area, and we'd actually edited a book on integrative medicine together. And Maury said, sure, it sounds crazy, but we can do the research. We can measure before, we can measure after, and we can document one way or another as something happening. So in this case, we recruited 5 women. They all had very small tumors, as you can see here from the pre-treatment ultrasounds. And this was pre-surgery. So there was like a 2-week window from diagnosis, confirmed cancer, to surgery. And there was no effect. Both from the ultrasound, which is very biased, as well as, the post-pathology measurement that you see pictured there. So these were all women at MD Anderson, and Master He was concerned about language barriers, cultural barriers, the ultrasound, of course, which there could be biases, And at the time I was living in Shanghai, where I was doing 6-month sabbatical as part of the center grant that we'd had and worked on for almost a dozen years with collaborators at the Shanghai, Fudan University Shanghai Cancer Center. And, you know, it's a whole other story of how we did that study, this study there. But we were able to recruit 4 patients from Shanghai. And in addition to doing ultrasounds, again, which has the bias, we did MRIs, pre-treatment, post-treatment, and we see no effect. So, you know, we kind of, you know, at least in that model, in the way that we did it, we didn't see an effect of qigong. Few years go by and I'm introduced to this individual you see pictured here, Sean Harabantz, who is known as a psychic, or, you know, a more pejorative term, a clairvoyant. And, you know, from my, you know, somewhat very skeptical point of view, and the fact that I'm even talking about this research, you may think that I'm the furthest thing from a skeptic. But, you know, I am quite a skeptic, and I'm quite a skeptic around the whole issue of soothsayers and people predicting the future, or knowing something about me that happened in the past, but they have no way of knowing it. And, you know, when you meet somebody like Sean, and he's quite unique, but there are others in the world who have these abilities, it's very hard to really to refute some of the things that they share and some of the things that they know. Now, a true skeptic, you know, and a researcher would say, well, let's look at how many hits there are to misses, right? And if we tend to pay attention to the hits and we tend to ignore the misses. So, you know, if they say 100 things and 20% of them are right, those 20, you know, may be quite remarkable, but they could be all by chance. And, you know, you guys are all familiar with statistics and the issues of probability and chance and all the rest of it. But I'll share one anecdote, which, you know, anecdote is not data, but it's very personal. And I'd already known Sean at this point for, you know, close to 10 years. And we had done some research together already that I'll show you. And I actually hadn't seen him in a year and a half, and he works with photographs typically, but he hadn't even seen a picture of me in over a year and a half. And I'd sent him an email asking him some questions about career decisions that were on the table for me. And I sent him via email, and we have an interesting form of communication where I'll tend to email him and then he'll leave voicemail messages. And he said, you know, in this situation, I'm happy to address some of your questions, but, you know, you need to call me. And this was back in March of 2018, and I was at a meeting in Chicago. And of course, I remember this conversation sitting in a hotel room in Chicago and call him. And Sean said, you know, I'm you know, going to get to your questions, but I need to tell you that, you know, I know you're sick, and I don't know what's going on exactly, but there's something going on in your blood. You have a blockage in your body somewhere, and you need to go and see a doctor right away. And that was a Saturday, and unbeknownst to Sean, I actually had a swollen lymph node in my left axilla that had been growing for, you know, a couple of weeks. And I assumed it was, you know, infected hair follicles, something like that. It was a bit painful. And, you know, again, it appeared from nowhere, and just in a 2-week period of time was palpable. So, you know, having heard stories about people who are told health things from Sean, I thought it prudent, and because of the pain and the growing that he, of course, shouldn't know about because he hadn't seen me and actually hadn't spoken to me until that moment in over a year and a half, I thought it prudent to see somebody at MD Anderson. And that Thursday had a biopsy, and it came back as melanoma. and, underwent immunotherapy. And, that was over 2 years ago. And I'm now feeling, well, actually at the time I felt awesome too, and never actually felt bad. And that's one of the interesting things about cancer. But the other interesting thing is Sean said, you'll be fine, but you need to start managing your stress and exercising more. And melanoma, more than other cancers, you could argue, is extremely immunogenic. And you all know about the link between stress in the immune system and exercise in the immune system. So prior to that, and again, it's hard for me to not kind of believe when somebody says to you on the phone, I think you have an illness, and in fact, they were right. But again, this is just one example. And I've asked Sean to actually, why don't we do a study of your readings of people, in particular health. It's just, it is overwhelming how accurate he is, and how many people's lives he probably literally saved because they didn't know that they had 95% coronary occlusion. And he says on a Thursday, you're not going to make it through the weekend if you don't go to an ER and get looked at. And the person felt fine, and they wanted to ignore him, but went to the ER, took his advice, and then found out again that they were 95% occluded without even knowing. So anyway, back to the research. Sean has actually been researched in particular by the laboratory of Michael Persinger up in Laurentian University in Canada, and looking at what his EEG pattern is when he's in, I guess, what you could call more of this clairvoyant-like state, when he's doing readings. And actually digitized that in this case, and looked at how a device developed from that pattern, that specific electromagnetic field pattern, what would happen to, in this case, it was melanoma cells in a petri dish. And we see two different patterns, magnetic field sequences, had an impact on cell growth. A subsequent study looking at time-varying electromagnetic fields in multiple cell lines, as you can see pictured here, had an influence. And this, again, is a slightly different pattern than what's called the Hairband's configuration. It altered cell proliferation in terms of tumor size in a melanoma animal model, seeing both a decrease in tumor size as well as tumor weight in the animals that were exposed to the electromagnetic fields, and showing an increase in apoptosis and a decrease in Ki-67, which is a proliferation marker. So we went into this relationship with Sean with some understanding that if we could replicate that, there should be an effect. Last year we published this paper in Integrative Cancer Therapies. We have a subsequent one coming out, and I'll show you quickly some of the data from these experiments that we did with Sean, both in vitro and a number, and I'm not going to show you all the data, the in vitro, because those are quick and easy studies to do, and then 4 separate animal studies. So in terms of cell viability, we worked with lung cancer cell line, and both human lung cancer cell line as well as the Lewis lung carcinoma, which is the animal cell line. And again, just growth of cells in a petri dish, we see a reduction when exposed to the experimental treatment. And it's clearly visible here in terms of the stained cells, far fewer cells that are alive after the 3-hour incubation period, with really just a 30-minute exposure to the treatment, which was shown. Importantly, because I'm so skeptical, I was the control person. So I could see Sean, I could see that he wasn't doing anything with the petri dishes, and I mirrored exactly everything he did. So when he put his head close to the petri dish, that's what I did. When he moved his arm over the Petri dish. That's what I did. The distance of the hand, the heat, the contact, everything the same. Similar to the work out of Harvard, we looked at some, cancer-specific pathways, in this case, phosphorylated AKT as well as ERK, and we see there's a modification in both of these pathways, both right at the end of treatment, which was only the 30-minute treatment, as well as 3 hours later. So then we moved into animal models, and you inject the animals, and then you wait until the tumors are palpable, and you know that the tumor is going to take, and then we started the treatment. In both these studies, and you see the sample sizes there, we started the treatment when the tumors were very small. And the tumors are growing in both the experimental and control, but clearly slower in the experimental animals. If we waited longer until the tumors were around 80 to 100 millimeters, there was no difference. And so in some sense, they needed to have this exposure to what we're positing is low frequency electromagnetic field before the tumors kind of took off. This is very aggressive lung cancer cell line. So, in some sense understandable once it's already developed. Tumor weight, tumor volume, we're seeing clear differences in the experimentals compared to the controls. This is a downstream marker for the mTOR pathway and a cytolytic proliferation marker that we see decrease. So again, understanding some of the biological mechanism whereby this treatment is working. Interesting and particularly interesting for me, having had melanoma, and the treatment that I received was an anti-PD-L1 immunotherapy. And although this didn't reach p.05, we see a clear reduction in PD-L1 expression in the tumors, and this is in the actual tumor microenvironment, and changes in some inflammatory markers, in particular MCP1. Similarly, as Gloria Gronowitz found, we see a reduction in Tregs and a reduction in macrophage infiltration of the tumor microenvironment. And in our most recent study that's going to be coming out hopefully next week in integrative cancer therapies, we didn't see as much of a difference between the size of the tumors over time, but a clear increase in necrosis. And so although the tumors were of similar size, 6 out of the 10 tumors were highly necrotic. So essentially there was not a lot of cancer cell activity in the animals that were exposed to the treatment. And I'll come back to this about, these 6 animals relative to these 4 that, even though they had the treatment, had very little amount of necrosis. Importantly and surprisingly, we saw a decrease in a stem cell marker. And many of you who know cancer know that it's actually stem cells that allow cancers to become immortal and transform into metastatic disease and colonate other parts of the body. And there is no treatment for cancer stem cells, and that's often a predictor of recurrence of disease, is that there's cancer stem cells that are floating around the body even after treatment, and we see a benefit there. And this is from one of the earlier studies that we did with Sean, and looking at the behavior of the animals. And it was very clear, without having to do statistics, which we ended up doing, and setting up more sophisticated way of collecting behavioral data, that there was clear behavioral differences. Here you see the control animals that I was treating, and then there you see the experimental animals. And again, you don't need fancy statistics to know that there is a clear difference between these groups of animals. We did in subsequent studies hook up GoPros behind the cages and collected behavioral data in more of an observational manner, but consistently. And in this case, we looked at the movement of the animals in group form. And there was about 50% less activity of the animals. And you know, what was interesting is that although on both the left and the right side of the cage didn't have a lot of difference, as we can see here, between if we were to look at these two bars, left versus right, of Sean's animals, the animals that were on the right tended to be clumped together, but near the back. And the animals were on the left were clumped together and near the front. Again, not moving very much. The 4 of the 5 animals that had high necrosis were on the left-hand side, the ones that were closer to the front. And what's interesting is that the work by Michael Persinger up in Laurentian University found that in particular, this unique frequency that's coming off of Sean's prefrontal cortex is on the right side and reflecting with the left when he's doing the treatment. So, you know, he tried to move the animals around in the chambers, but it is perhaps, and it's just positing at this point, that the animals on the left side got more exposure to these purported electromagnetic fields that we think could be the mechanism. Now, we didn't measure Sean, we didn't measure his EEG, we didn't measure EMF, we didn't measure the biophotons coming off his body, and that's something that we need to do. And we're thrilled to be able to continue this research. We're getting a very sizable grant from the Emerald Gate Foundation to be able to continue this research, not only to be able to measure what's going on in the biofield therapists and bringing more biofield therapists to the table, but also doing blocking experiments. Can we block the effect? And, you know, for example, if you put the cells and the animals in a Faraday box and you block the electromagnetic field, will the effect disappear? If the effect is still there, then it's something different. Some people hypothesize it is something different, because how would you explain distant healing if it is just electromagnetic fields? And that's when we get into the area of entanglement and physics and you know, things I don't personally understand, but physicists you know, clearly believe that concept of entanglement, of course, is real, because they can document it and understand it. And this perhaps could help to explain some of the phenomena that we're witnessing here. So I will close just thanking in particular Pei-Ying Yang, whose laboratory supports this crazy journey that I've taken her on. And continuing in this area, and of course others in the lab, and Sean Harabentz in particular, and leave you with this quote from William James, who is of course the father of the field of psychology. And he says, when something is new, people will say it's not true. Later, when its truth becomes obvious, they say, well, it's not important. Finally, when its importance cannot be denied, they say, well, anyway, it's not new. Hopefully, we are somewhere on this path and moving down the saying to hopefully show that its importance cannot be denied. Thank you.
Dr. Cohen, thank you so much. Would you be able to take a few questions? I know we're a little bit over, but it would be great.
No, my pleasure. Sorry to take us up right up to the hour.
It was just so engaging. We didn't want to stop you. So, so we have, I can just read the questions. We have a question about, can any of these biofield therapies be applied over long distance, or do they need to be applied locally? And I think you started to get into, you know, that kind of question. And I just would add to that, you know, is there any do you know of any collaborations between physicists who really are in that space and researchers like yourself to try and bridge that question?
So the former question, I think that research, there has been some research that has, in particular from the clinical perspective, and I believe it was in the area of cardiovascular disease, that some initial positive findings and it wasn't replicated. So it hasn't been examined, I think, in a rigorous, systematic manner. Although from the field, there's the claim that distant healing is something that works and can happen. But again, I think the phenomena hasn't been studied well enough. From the physics perspective, I think there is a better understanding of the concept of entanglement, and that, if two molecules, two substances that have been in the proximity of each other are then separated and literally on different parts of the world, if you do something to one of them, you can detect that something has changed in the other. What is that? I mean, that's very hard to understand and explain, and helps us to, if there is evidence that is irrefutable about distant healing or distant intention, that kind of physics-based experiments can at least help to explain it. And in terms of collaboration, there's Consciousness and Healing Initiative that was founded by Shamini Jain, acronym QI, that is really trying to do that and bringing people from all different fields together. And I've been part of Shamini's group and attended some of the conferences. And in fact, tomorrow afternoon, I think it's at 1:30 Pacific time. I should probably get the exact time. I'll get it while we're talking.
Yeah, sure.
We're doing a conference that's part of the Shift network conference that's going on right now
Yes,
over these next 3 days. And so we're going to have a panel on healing and healthcare at 1:30 Central Time. And starting to get into, again, some of the science and the rigor in that area. We need to have the physicists at the table because, they understand and actually, I don't want to use the word believe, but they have evidence that this phenomena, at least in theory, should work. And you start talking about Einstein and space-time continuum, we think in a very cause and effect and linear manner. But that's not the way the world actually works. No matter how many times you tell me that, the time is not linear, we live in linear time. I mean, we're so conditioned in that way, but we're wrong. And people like Einstein and others know that that's not the case. So we need to have them help explain some of the phenomena that we're discovering.
Yeah, we've worked really closely with Chi and Dr. Shamini Jain, and actually some of the researchers will be joining our research committee for our conference coming up, and their work is really phenomenal. So it's great that you'll be speaking tomorrow. Some of us here are also looking forward to joining that conversation. So,
excellent.
A couple more quick questions. How does Sean explain his healing gifts or prophecy? Is there anything you can share about that?
Well, I mean, he's had more experience with the prediction area, and he's actually a very religious person. So I have to, put that out there, and that's in some sense his personal belief. That he's hearing something, that he sees angels that tell him things. But the way he's described it is that there's two, he gets inklings of things and senses things, but at other times he actually sees something, and he's described it as kind of seeing a black and white movie, you know, in one of these old movies that it's not totally in focus, and you kind of see, at least this is what I'm picturing as he describes it, you see, you know, you don't see the whole frame, but you can see enough of what's going on. And he says when he sees that, that's essentially something that's going to happen. Now, you know, and I've tried to push him on it, it's like, is it going to happen or has it happened, right? If we're thinking about, again, from Einstein's, you know, theories of time-space continuum, the things aren't linear, it may not be that he's seeing something in the future. He's seen something that's already happened, because our future has already happened. And when I start saying things like that, I don't know what I'm talking about, because it doesn't make sense to me. But again, I know physicists don't see it as, you know, tomorrow, you know, hasn't happened. It actually has happened. And then you can get into the multiverse and all these other areas of physics that that people are talking about, and that, you know, every moment there is a split in some sense the universe, and there's multiple things going on at the same time. The area of health, though, is that I don't quite understand, because his sensitivity to somebody's health from looking at a photograph it's pretty scary, and you better listen to him if you know, choose to seek Sean's advice about your health. If he says you should go and see a doctor, you should go. Again, you know, even in that case, if you're the most skeptical person and you think that, you know, it was just this random, you know, 50-50, he had just as high a probability of getting it right as wrong. It's pretty overwhelming, the hits and the specificity as well, you know, saying that it's something in the blood versus something, you know, more emotional based, whether it's, you know, a particular organ, very accurate in that way. He sees it as just not a parlor trick, but just something that's so obvious. He doesn't even want to research it, because it's just like, well, I've done it 1,000 times. Of course it's true, right? And of course, being a hardcore scientist, it's like, but Sean, we haven't, you know, done the 50-50, and, you know, are you sure, you know, the level of accuracy, if you're able to be 80% accurate, that's like overwhelming. Nobody will believe it if you just say it, but if we set up a study, you know, it's a whole different thing.
So one more question.
Yeah.
What is, and this is a little more practical for the clinicians out there, what is the best way to get healing touch or other energy medicine modalities into cancer centers? Or in light of the prejudice you've kind of mentioned in your talk, what are some, you know, some suggestions you have for those that are working really in the system?
Yeah, well, you know, institutions that are, you have to know your institution. So I know MD Anderson, and we're not going to do healing touch or Reiki. We have acupuncture, massage, all the mind body programs, but doing the more traditional energy medicine wouldn't be well received. And the question is, what do we lose by not offering it? Well, you know, for some patients, we're missing an important modality, but, you know, we're covering a lot of things that for sure can help with symptom control. At a place like MD Anderson, I think, you know, even with the clinical trials, it's not going to be enough. We need to have the mechanism. We need to be able to block the effect, and we need to be able to augment the effect, and really know it's biophotons, and humans emit biophotons, and the electromagnetic field of me can be transmitted to somebody else, and we really understand the mechanism. For, you know, Brian Berman's organization, and I'm sure everyone knows who Brian is in your organization. They didn't need that level of evidence. They just needed to show that it changed, you know, perceptions of the practitioners in the trauma center, and that was it. You know, they were done, and it's still part of. I went and, you know, did some you know, just Google searches, and the program's still ongoing, and they're still writing about it in the lay media. So it depends, you know, on the institution and the level of comfort. You know, at a minimum, you need, you know, the evidence. Again, you know, it's modest, but it's there. And for some people, that's enough. Yeah. You're muted.
Thank you.
Yeah.
I really want to thank you for your courage, for your really the focus on the level of scientific rigor. It is just so important for this work to move forward, and for your living in these two worlds. I just think it's beautiful the way you share about Sean and being in such a just well-respected institution. It really means a lot. We at the Academy are very focused as well on evidence-based medicine. And so we're just so thankful. You have so many fans out there, and I just want you to know, you know, there's just a huge community supporting your work, Dr. Cohen.
No, thank you. That it means a lot. And these these past few months in trying to negotiate the final agreement between this foundation and MD Anderson took a very challenging turn. And so knowing that energy and support is out there means a lot, because I think it's going to take our whole community to you know, tackle this area.
That's right. That's right.
Yeah.
So I'm just going to close up with a few invitations. So first, you know, for those of you who are around tomorrow, definitely join Dr. Cohen with the Shift Network, Dr. Mimi Guarneri, and Rowney King. The two of the founders of this organization will also be at the Shift Network tomorrow presenting, and maybe you'll all be on the same panel, who knows, but we're really excited about that work. Please continue to come to our webinars every week. Next week, Rowney, Pritton, and King will be leading us off in a meditation on Monday, and those are always at 8:30 a.m. Pacific time. And then next Friday, we'll be reuniting again with Jamie Harvey. He'll be doing a forum exploring relationship building and sense making in the time of COVID and our climate emergency, which for those of us on the West Coast, I mean, it has just become ever so more real. With the level of challenges that we're all facing here with the smoke, and it's just unbelievable to live in California and listen and hear colleagues all up and down this coast just being so challenged by what is happening out here. So I really invite you. Jamie's talks are always interactive, so it's a different forum than here is more of a webinar forum. So please come and join us. Of course, we have a fellowship program that is launching our next cohort in October. So if you are interested in really getting more deep education around this, it's a 2-year, 1,000-hour fellowship that can lead to ABOIM board certification for MDs. It's interprofessional, so we invite you all if you're interested in gaining more education around integrative health. And then I really want to invite all of you. We have just put together such an amazing online virtual conference this year, October 9th through 11th. It'll actually open the 4th and run till November 1st. But we're really bringing together lots of incredible leaders to begin a dialogue with all of us around multiple areas, including diversity and inclusion and that work in healthcare. So please join us and join the other leaders for that conference. And finally, just stay connected with us. All of the webinars that we do, we stream to Facebook. They are on YouTube. They're all available for free. So share them with your colleagues. Come back and watch them if you weren't able to do that. Join our community. Become a member. You know, we are clinicians, researchers, administrators, really a wide patients, a huge membership that really wants to work together. And I think, Dr. Cohen, what you said earlier, it is going to take us all coming together in so many ways to move the work that we do in integrative health forward. So thanks again for joining us, and thank you for those of you who stayed longer today. Dr. Cohen, again, thank you for presenting and for all the amazing work you do.
Thank you. Thanks everyone for joining.
Bye-bye. Have a great weekend.
Bye. You too. Good luck.